Hello, I welcome you to this lesson. I'm going to look at the general nursing care that you can give to a patient with a medical condition. Of course, 2020 has been declared as the year of the nurse, and it has been declared so because the profession actually clocks 400 years of existence. All credit goes to Mama Florence Nightingale actually for making it possible for people like us to have been oriented within the medical field as nurses. All right. So, in looking at this lesson, I would like to put in something I think that will still be related to the lesson, but I know I'm just trying to connect with the lesson. The nurse is as important as the physiotherapist, the doctor is as important as the cleaner in the hospital, and the pharmacist is as important as the physiotherapist. So we may have different ratios that might be required for people to be employed or work within the hospitals, but it is important to know that we are all important. So when you're celebrating Nurses Day, we do not mean nurses are more superior than any other profession within nursing. Of course, as also a nurse, I also believe that the head is as important as the hand is as important as the bladder is as important as the liver is as important as the kidney, and all these things they work in unison so that I have good health. Please, if you have any of these missing, it just makes you unique and not necessarily a disability, of course. So, in trying to connect with the lesson, um, when we are doing the nursing care, we do not do it as an island. We believe there are certain items or dimensions that need to be put in place, of which we coordinate the whole team so that we provide the best of care to the patient. All right. So now, when you look at the patient holistically, there are certain things that they need to do independently, and if they do not do them, it may be a sign, or it may be because of an illness or a disease. Okay. So anonymously, someone came up with a certain guideline known as a prophenema, which is an acronym actually. A prophenema and stands for something which I've tried to break down just behind me on my board there. I've tried to break down this prophenema, what it really stands out for. A lot of people have difficulties in understanding or analyzing and understand what the apophenema is all about because they think it's just now in right position, right risk, right observation, you like psychological care and the likes. Nursing is an art. Nursing is also a science. When you say nursing is an art, there are certain skills that you need to have in order for you to apply nursing. And as a science, there is a body of knowledge that you need to beg from or you need to borrow from for you to practice your nursing. Okay, so let me not bore you with that. Let's look at general nursing care of the patient. So when you're looking at the general nursing care of the patient, there are certain aims that you need to come up with based on the patient that you are nursing at that particular time. Of course, nursing has certain goals that needs to be satisfied in all conditions, and that is restoration of health, treatment, educate, maintaining good health, promoting good health, preventing diseases. So those are more like the general goals of nursing. And from there, when you're now drawing up your aims mostly are to treat, to maintain, to promote, to prevent, and you do all that so that you improve the well-being of the patient. Okay, so aims, you are coming up with the goals, coming up with more like objectives that gives you a roadmap of what you want to achieve before you discharge the patient. Of course, that is the way it is. All right, so the next item is position. So position, look at the systems within the body, the cardiovascular system, the respiratory system, see how they are affected. So, in definition of health by WHO, you talk about the physical, the social well-being, and also the emotional well-being. Of course, you look at all those things. So now we are looking at these as dimensions in their prophenema. We're looking at them as dimensions that we need to assist the patient in so that they have good health and they can be able to function independently. So position is important in order to improve circulation of the patient. If patient is just seated or lying in one position, there might be an impairment in blood circulation. Just being in one position for a long time also affects your comfort levels. So the nurses out there to help you improve your comfort levels by ensuring that you change position. Position also is important because may alleviate some certain pain if at all you take the appropriate position that is needed. Okay. Then the next part is rest. Rest is important because when a patient rests, it helps them to recuperate. It helps to reduce mental fatigue. Rest is important also because it also just helps the general patient to improve in the general feeling because it is reducing mental fatigue. Body needs to rest. All right. So the next item is observation. Observation, when we look at it in nursing, mostly it has been about temperature, pulse, respiration, and blood pressure. Of course, these we call them as vital signs because they help us to give us an idea of what is happening within the patient's body or inside the patient's body. Of course, we do not just stick to the temperature, pulse, respiration, and blood pressure as the vital signs that we should always go by. Of course, the other parameters that also we need to look at. So these they also act as key principal indicators in knowing whether the patient is improving or not. Of course, we look at the fluid intake and the fluid output. If a patient was edematous, we need to weigh the patient and see if at all they're reducing. So that will be, it is reducing is a sign that now the patient we are winning the battle of patient who was edematous. Now we are winning the battle, so we are moving the excess fluid. All right. So after observation, the next part is psychological care. As human beings, we are psychological beings, and being admitted in the hospital it affects a lot of our programs. But we have a business program, business appointment, and all those things, and that creates a lot of anxiety. So as a nurse, or as a nurse, it's our duty to allay anxiety in our patients, and that satisfies the psychological being within the patient. So psychological care, you need to explain the condition to the patient. When you explain, the patient will have more understanding on the signs and symptoms that they are able to see within the condition. So when you're talking about psychological care, it's just so important to invite the crazy because it also satisfies the spiritual longing that the patient may have at that point. All right, so then we look at hygiene. Hygiene, if it is not in equilibrium, you find that you are predisposed to diseases. It is not in a hanging in a balance, you are predisposed to diseases. So nurses have a duty to, if patient cannot perform certain activities independently, have the duty to help in the nail care, hair care, helping patients to, to bath so that they can be hygienically clean. And there are many more other areas of hygiene that the nurse will help the patient in so that we maintain the well-being of the patient. Of course, that is to do with hygiene. And when you are writing your nursing care, you pick on certain elements that you need to put in order to improve the patient's hygiene. The next part is exercises. Exercises are important because they improve the mental well-being, and exercises are very important because they also sharpen certain receptors within our body and improve the body's response to infection. Okay. All right. So when I'm talking about exercises, it does not include myself. I have to exercise so that I meet the necessary body mass index, so that I do not predispose myself to certain diseases like diabetes or obesity. So I do exercise a lot. Hopefully, I'll beat the body mass index requirement. Exercises will improve certain receptors so that I can use the insulin very well, as I'll be preventing diabetes. All right, so that is exercises. There's more to it that you can actually put in writing or that you can put in order to help the patient. The next item is nutrition. Nutrition is important in the patient's life because we are looking at the issue of proteins that they need to repair worn out tissue. Patients need energy, so they need carbohydrates. Patients also need fat containing foods because certain hormones they are carried by these fats. Of course, on the issue of fats, they should be in the required normal standard because too much of it also can bring about diseases. Of course, when I'm talking about the issue of that, and then I say fats, they are that's like a ketogenic diet where certain components are prescribed, but we have certain limits that we need for all these food requirements that we need within our body. All right, then we have vitamins. Vitamins are very important in improving the general well-being in terms of immunity, so they are very important within our body. Okay. So that is on nutrition, and then the next item after nutrition we can look at, I think, is environment. Okay, so environment is important in the patient's well-being, and when talking about the environment, we are looking at the physical aspect, the emotional aspect, and the social aspect of the patient's environment. So these they need to be taken care of so that we multiply, we we manipulate them. Okay, that's the way that I was looking out for. We manipulate them for therapeutic purposes. So the environment, we want to have all the things that we need near to the patient in case of an emergency so that we can institute measures within a short period of time. So that is to do with the environment. So after environment, we can look at the issue of medicine, drugs, pharmacology. So our patients also need to take the drug at the right time. Okay, should take the drug at the right time using the right route. All this is important in order to help the patient improve within the shortest period of time. If a patient does not take the drugs according to the physician advice, then patient is less likely to recover within a short period of time, and it can create about resistance to these drugs. So it's important the nurse that it's important for the nurse to ensure that the patient takes drugs according to the doctor's advice. Yes, then the last item actually on the general nursing care of the patient is advice. Okay, when I was talking about the goal of nursing, I was talking about the use of what education. We don't want the patient to come back with the same condition. So our patients should be educated more about their condition so that they can prevent the reoccurrence of that disease. All right, so we were looking at the general nursing care of the patient with a medical condition. So, how do you understand now this general nursing care so that you do not have problems? Okay, it does not apply for each and every disease, but how do you understand this? Please, whenever you want to apply the general nursing care, always have the signs and symptoms at hand within. Okay, know the pathophysiology or know the signs and symptoms within the condition. When you know the pathophysiology or you know the signs and symptoms within the condition, it now helps you to nurse the patient based on the signs and symptoms that are there. So when you have learned about the general nursing care, meaning you can now nurse any patient because it's just important for you to know the signs and symptoms. When you know the signs and symptoms, you'll be able to identify the problems that the patient is having. Hence, you know the systems that are affected and then you come up with the measures. Of course, there are certain other skills that are needed that you need to have as a nurse so that you know which skill to apply in order to help the patient within this. So don't stress too much to say, no, me, I've never nursed a patient with this condition. I've never, you just need to understand the condition. When you understand the condition, the signs and symptoms that are there, then you know the appropriate measures but I needed that. Mention you need to know the pathophysiology within the condition, or you need to understand how these signs and symptoms are coming about. Then you'll be able to apply the general nursing care of the patient. I thank you most sincerely for listening to this lecture. If at all it has helped you in any way, please feel free to share and then subscribe to my YouTube channel, Loyalty Television, so that the next time we come and present another lesson, you'll be able to follow and understand most of these lessons or challenges that you might be facing in listening. Remember, subscribing is free. If you did not like the video, don't share, don't subscribe. Otherwise, this is 2020, the year of the nurse, and we want to improve the challenge, improve on the challenges that students may face when they are nursing patients and even members of staff out there. So thank you very much for listening.